In Tanzania, around 800,000 women of childbearing age are living with HIV. Although the country has achieved a 69% reduction in new HIV infections among children since 2009, more than 91,000 children aged 0 to 14 years old are HIV positive, putting Tanzania as the 5th highest number of HIV-positive children in sub-Saharan Africa. In 2015, there were about 6,500 new HIV infections among children in Tanzania. This represents the 3rd largest number in sub-Saharan Africa, after Mozambique and Kenya. One of the challenges faced is pediatric diagnosis. Indeed, only 42% of infants receive early infant diagnosis of HIV.
Mbeya is among the region which has a high HIV prevalence in Tanzania and has a specifically high prevalence in pregnant women. HIV early infant diagnosis is usually done from the dried blood spot, which should be collected at 4 to 6 weeks from babies after birth. These samples are then transferred, are then sent for HIV DNA PCR at the Mbeya Zonal Referral Hospital, which is a specialized laboratory which can perform this test. They receive a lot of samples and that's why they have high workload. In this study, we placed the GeneXpert system at the obstetric case facilities and we trained the nurses and the midwife on how to perform the test. We then investigated the performance of expert HIV inquiry to diagnose infant neonatal HIV infection from birth until week 6.
A prospective cohort study was conducted in Mbeya to investigate the performance of the Cepheid GeneXpert system that can be used at the point of care using the Expert HIV-1 qual assay for early infant HIV diagnosis. Within the study, the accuracy of viral load monitoring in HIV-infected mothers at delivery was also investigated using Expert HIV-1 viral load.
Our experience with the GeneXpert at the point of care has been very good. Nurses were quite familiar and confident on how to do the test. The main challenge were related to power cut, which required a system which provides sufficient backup power.
The Expert HIV-1 qualitative test is very easy to use and it didn't require a lot of training.
The greatest benefits we get from the GeneXpert is that we get the answer in 90 minutes before the mother and baby get back to home. I would like the system to continue because it helps our mother, because the mother gets the answer the same day they deliver their baby.
The babies get a benefit because if the baby is positive and we detect early soon after delivery,
and helps us to refer them to the local CTCs for more treatment.
They get care.
During the study, we identified the baby early.
The sample processing turnaround time has decreased since we started using GeneXpert because the sample collection and the sample processing take less than 2 hours. We don't have to wait the batch test from central laboratory. It is benefit because we are able to ensure that the baby who are positive are identified at birth and they give possible care before discharge to home.
They're very happy, especially being able to do the test, because it used to be done in the lab, but now they do it themselves. So even for them, they feel like they contribute much to the patient care. Treatment of HIV-infected babies is provided by the Care and Treatment Center in Mbeya, Tanzania. And it's important to treat babies early because it has a high impact on morbidity. Having the ability to diagnose and initiate treatment early, soon after birth, reduce the number of HIV-infected babies who are lost to follow-up. The GeneXpert point-of-care test is feasible to be used in a public health setting and has the potential to improve the HIV early infant diagnosis cascade. This will allow for high uptake of HIV early infant diagnosis testing, specifically the potential to initiate early life-saving antiretroviral therapy in children. Being able To do point-of-care viral testing to the mothers will help us to assess the risk of mother-to-child transmission. Will help us also for immediate decision to initiate enhanced prophylaxis to the neonates. This is important because it will allow us to identify women who should receive enhanced antiretroviral therapy counseling to the neonates, but also it will help us to decide when to switch to the second-line regimen. Additionally, this will reduce the risk of mother-to-child transmission during breastfeeding. I want it to be available, especially in the remote areas where we have a lot of challenge getting these samples.
I feel good because I have identified them earlier.
And I hope we can continue to provide these services to our women.
If this will be rolled out countrywide, then I think it will help a lot.